today's video topic is what happens if you don't treat hernia. Suppose this is the most of the people after getting diagnosed that they have a hernia. The first question they ask, okay doctor, if I don't take treatment or if I don't undergo surgery, what will happen? Should I go surgery immediately? These are the questions they'll ask. In the previous videos we have talked about hernia, what is hernia, how it comes and what should we do, what we should not do, what are the treatment options, and these are all things we have seen in the previous videos. Here, suppose once you get diagnosed that you have a hernia, as we know, is an abnormal protrusion of internal organs through the wall that it contains. It's something like, you can compare, in the previous videos we were told, we can compare, if you suppose your shirt is torn and your innerwear is coming out, that's called hernia. Suppose the shirt is torn, it has to be stitched. The same way, if you have a hernia, the best treatment or the best treatment modality is surgical correction of the hernia. Okay, whether it has to be done immediately, then first thing first these questions you should ask your surgeon. He will explain what is hernia, what are the content inside, whether it will give you any trouble, and depends upon your age, your profession, your lifestyle. You will advise either immediate surgery or some time later, all this. Suppose okay, the surgeon, you couldn't ask the surgeon. Suppose you have a hernia. The simple thing is hernia is nothing but a hole through which the internal organs are coming out. So once, if you delay the treatment options, the hernia hole, the defect can become bigger and bigger. So once the hernia hole becomes bigger, more internal organs can come out. Even for some people, inguinal hernia, the groin hernia, the whole abdomen intestines, they are all in meters. They can come down. The whole abdomen is called scrotal abdomen, they call. The same way, the whole thing can come down. Not only that, along with the intestines, other organs also, like your urinary bladder, your rectum, colon, all these things can come out. In females, even the ovaries can come out, uterus can come out through the hernia when it becomes more bigger and bigger. And if you delay the thing, suppose the patient is fit for every surgery, but if they delay it, the future, suppose their anesthesia fitness may be compromised. Suppose they may get cardiac problem, so the anesthetist will say these are the anesthesia could be given or not be given. They will say for laparoscopy, general anesthesia is very important. They will say no, we cannot give general anesthesia, so they have to give only spinal anesthesia. Or suppose you get diabetes, then since we are going to keep a mesh inside, the chance of infection is very high. And suppose we don't treat it, the pain because of the hernia can increase. Not only that, the intestines, most of the time the hernial content is always the intestine, and especially if it's the incisional hernia, the intestines can get twisted, and they can cause bowel obstruction, causing emergency surgery. The emergency surgery, in the previous videos we told, the success rate is little lower and the chance of recurrence is little higher. So not only the obstruction, the next level, it can even compromise the blood supply to the intestine. So you can get gangrene, bowel gangrene, especially in incisional hernia. The incisional hernia is happens because of the previous surgery. So these are the complications or the unwanted things that can happen if you postpone or if you delay or if you don't get yourself treated for the hernia. So ask your surgeon what to do, what not to do, and how long you can wait. And especially if you are traveling a lot, especially out of the country, or even if you can travel, then you may get these kind of complications. So the earlier the better for these kind of people, and people with old people, earlier the better. Even young people, is always ask the surgeon about the hernia, the pathophysiology about the hernia, learn about that and take care of yourself. Thank you.